patient who has been diagnosed with cancer can wait anywhere from 3 to 6 months to receive Social Security insurance and temporary assistance for needy families. Sobreviviendo el Cáncer, Surviving Cancer, is an exclusive program at University Medical Center developed to help low-income cancer patients undergoing cancer treatment who have exhausted their financial resources and are at risk of failing to adhere to their treatment plan because of financial difficulty.
Your whole world is being turned upside down. It's a light at the end of the tunnel.
You know, because even if you have insurance, you still have other financial responsibilities.
Sobreviviendo el Cáncer program started in 2004 when a special group of social workers at UMC noticed that many oncology patients were struggling financially to meet the requirements of the medical care that they must have to become cancer survivors.
It's not about the cancer patient, it is about patients, human beings who live with cancer, and that's a very big difference. They are not defined by the cancer because they are human beings with dignity and need for respect. They are just going through a horrendous crisis for the most part that requires assistance.
When I would do my psychosocial assessment with the patients, I would hear their financial difficulties, their financial hardships.
They can't go to work anymore. All of a sudden they have this sudden crisis, and during the crisis they're planning, what do? I can't pay my rent. The light is going to be disconnected. So if we can assist them through that interim of 1 or 2 months and get them back on track, they can refocus back to their medical plan, which is really the goal of UMC and the doctors.
In 2008, UMC Foundation started to support Sobreviviendo through grant requests and events like this. Sobreviviendo el Cáncer provides assistance with prescriptions, durable medical equipment, travel to and from medical appointments, and co-pays for physician visits, lab work, chemotherapy, and PET-CT scans. All patients referred to the program receive a biopsychosocial assessment to determine adequacy of the patient's support systems, the family's ability to help the patient cope with cancer diagnosis, financial eligibility for services, and any risk factors that may interfere with the patient's care plan.
Well, I was living in Las Vegas, Nevada at the time, and I knew I had the lump in my breast, but I waited about 8 months before going to the doctor. When I found a lump, I would keep telling my mom, I know I have cancer, so I didn't want to go because I was scared. So I was really sick in Las Vegas, so I went to the hospital over there, and it was confirmed that I had stage 4 breast cancer. It had spread to the bones. So at the time, I decided I needed to be with my family, so I relocated back to El Paso. So actually, I had a choice to go to any hospital, but I chose UMC. And I've been getting treated here for 2.5 years now. I was 31 when I got it. If I would have went to the doctor sooner, it would have been a little bit easier. The chemotherapy was very hard on me. And then after chemo, I had surgery, and I had a double mastectomy, and then I had radiation. Yes, my mom ended up losing her job. And it felt bad because it was probably because of me. The funds has helped us with assistance to pay, our rent, utilities. She has paid a lot of my medications before. I'm not really sure what we would have done without her assistance.
The loss of income for some cancer patients often places them and their families at risk for eviction and homelessness. For patients unable to work while undergoing chemotherapy, Sobreviviendo even provides short-term housing assistance to help pay for rent and utilities.
Me sentí una bolita en el seno y yo pensé que era algo anormal. Yo hacía 7 años que no me hacía yo una mamografía, y entonces el doctor me preguntó y yo le dije pues la verdad, y me dijo que tenía que hacerme una mamografía. Me la hice y salió mal. Luego me dijo que tenía que hacerme una sonografía, también salí mal. Y luego me dijo que de la biopsia, y salió mal, y luego me dio la noticia de que tenía yo cáncer.
Initially, Mrs. Knobloch completely declined to follow up with the treatment that the doctor was recommending. She said, I'm not going, I don't have the money, I cannot stop working. So Ms. Knobloch works as a cleaning houses for different families here in town. And so basically she relied on that income to survive, because Mrs. Knobloch was waiting for the survivor's benefits from her spouse. So once we told Mrs. Knobloch that we're going to help her with her rent, and we were able to pay a couple of months for that rental fee and also the utility bill that she pays. Once we told Ms. Knobloch that we were going to be able to provide short-term financial assistance, she was in agreement to follow up with her treatment, and she actually completed all her treatment. I can say that Mrs. Knobloch is a very successful story.
Me han ayudado mucho y yo les estoy muy agradecida, muy agradecida. Apenas ahora en abril se resolvió mi situación.
As the only not-for-profit charitable hospital in the region, UMC does not turn away patients because of inability to pay. Some patients with insurance find that their insurance runs out in the course of their care, and without assistance, they cannot continue their treatment plan.
A lot of people don't know how important it is to donate or how important the funds are, but it really does help out the cancer patients. Without the people donating, there wouldn't be no funds to help us out in the hard times.
In the last year, 6,050 patients with cancer were seen at the University Medical Center of El Paso Infusion Center. 1,739 of those were cancer patients with socioeconomic challenges whose needs were served by Sobreviviendo Surviving Cancer program through your support.
Son unas experiencias que no se les deseamos a nadie, a nadie, a nadie. Y que le damos gracias a Dios y que de mi parte están en mis oraciones todos los días, porque Dios los proteja y les dé más para que sigan ayudando a toda la gente que en realidad lo necesita.